Good evening, everyone. I hope you all are seated, comfortable, and ready to learn conceptually. So, I'll introduce myself. Many of you must be knowing me also. I'm Dr. Ankit. So, today the agenda for our class is to learn the previous questions of INI-CET, NEET, and FMGE. And remember, we are not just here to learn the answers of the questions which were asked previously. हम वो questions सिर्फ रटेंगे नहीं. We will learn the basics behind it. Remember, अगर basic आता है, concepts आते हैं, you will surely mark the answer. Okay? So, ready to go? So let's start our agenda. But before starting our agenda, बच्चे कहते हैं सर फार्मा में ड्रग के नाम याद नहीं होते. सो लॉन्ग स्टोरी. एक बार अगर आप गालिब से पूछो कि यार ड्रग के नाम कैसे याद करें, तो गालिब ने भी हार मानी हुई है. तो गालिब ने कहा था, आप पढ़ रहे हैं, मेरे लफ्ज़ों से ना कर मेरे किरदार का फैसला, तेरा वजूद मिट जाएगा मेरी हकीकत ढूंढते ढूंढते. सो अगर गालिब हार मान गया, उसे मानने दो, हमें हार नहीं माननी. रिमेंबर, देर आर ट्रिक्स, देर आर कंसेप्ट्स, and it is pretty easy to remember the names of drugs, and it is even more easier to learn the concept behind it. So keeping this thing in mind, let's start with the first question. I'm also as eager to teach you as eager you all are waiting to listen. So first question is, and try to answer, and then we will learn the concept behind it. So the first question is, which was asked recently: in which of the following route of the drug administration the drug undergoes first pass metabolism in liver? तो कौन से रूट में the drug first goes to the liver and then comes into the blood, and meanwhile when it is going into the liver degrades the drug. Degradation of drug means metabolism. So what is the answer? Oh, absolutely fine. Great to hear. So opening start बहुत अच्छी हुई हमारी. So the answer is oral route. So the answer for our question is oral route. Any reason, sir? Very simple. Remember, when you take any drug orally, all the drug first get absorbed into portal vein, and portal vein drains into the liver. So suppose ये हमारा GIT है. अगर आप कोई भी ड्रग ओरली खाते हैं, तो GIT में से या तो स्टमक से एब्जॉर्ब होता है, या फिर स्मॉल इंटेस्टाइन से ड्रग एब्जॉर्ब होता है. मेनली इट इज स्मॉल इंटेस्टाइन. मोस्ट ड्रग्स दे गेट एब्जॉर्ब इनटू स्मॉल इंटेस्टाइन बिकॉज ऑफ ग्रेटर सरफेस एरिया. बट रिमेंबर, before it can reach to the heart or systemic circulation, the drug first comes into portal vein, because all the blood of the GIT drains into portal vein, and portal vein we all know goes to the liver, and from the liver we know inferior vena cava is produced, and inferior vena cava drains to the heart. Whenever the heart word comes, it means systemic circulation. तो बताइए, थ्रू विच रूट अ ड्रग अंडरगोस फर्स्ट पास. फर्स्ट पास मींस अभी हार्ट तक नहीं पहुंचा, उससे पहले ही, बिफोर इट इज रीचिंग टू द हार्ट इज गेटिंग डिग्रेडेड. द आंसर इज ओरल रूट. एग्रीड? सो जस्ट टेल मी वन फॉलो अप क्वेश्चन. इफ यू हैव गिवन 100 milligram of the drug, in heart you are finding only 40 milligram of the drug, how much of the drug is degraded by the liver? Can we say, sir, 60 milligram of the drug is degraded by the liver? This is known as first pass metabolism of liver. Now tell me, first pass metabolism of liver, what effect it will have on bioavailability of a drug? हमारी बॉडी के लिए, फॉर आवर बॉडी, विच ड्रग इज अवेलेबल, सर? 100 और 40? फॉर आवर बॉडी 40 milligram is available. It will produce action inside the body. So can we say that first pass metabolism of liver reduces bioavailability of a drug. Shabash. Proud of you. So this is the visual depiction. You have given a drug, portal vein, heart, IVC. It reduces bioavailability. Finished. Let's come to the next question. Z technique for intramuscular depot injection. Any advantage? Now remember, sir, when we give an intramuscular injection, suppose this is the muscle. We give an intramuscular injection at 90 degree and the drug comes into the muscle. Agreed? Now tell me, if we remove the syringe, this drug may come back into the subcutaneous tissue. And just suppose the drug is having a color. Let's take an example, iron injection. If this drug comes back from the muscle into the subcutaneous tissue, it will lead to staining of subcutaneous tissue. That is why we never give intramuscular injection directly. No, we rather give by a zigzag technique known as Z technique, because Z technique prevents this back leakage of drug into the subcutaneous tissue. ड्रग वापस लीक करके बाहर नहीं आएगा, zigzag टेक्निक से देंगे, and the subcutaneous tissue will not be stained. So the advantage is it avoids staining of subcutaneous tissue. Agreed? So what are the drugs we have which are given as a Z technique? So the first injection is iron injection, we all know. Agreed? Second, very important, just imagine a psychotic person comes to you, a person who is psychotic. Do you think, bachcha log, that the psychotic person will believe that he is suffering from a disease? No, sir, he will not believe, but he will say, I am the richest person on the earth. Aishwarya Rai is my wife. So the point is that patient has delusions. My question from you people is, if you give an oral drug, oral antipsychotic drug to your patient, will he take your drug on regular basis? Will a psychotic person be compliant in taking your oral drug on regular basis? No. So that is why we make intramuscular depot injection of antipsychotic drugs. We call the patient and we give once a month intramuscular injection. Example, haloperidol. There are many injections which are available. You have to remember a drug, haloperidol. Agreed? Let's come to the next question. Very good. So this is the summary. If you will be seeing this video again, you can have the screenshot with you. Let's come to the next question. Let's see who can answer. It's a tricky one. थोड़ा सा tricky है. Which of the following is given as transdermal patch for motion sickness? You know, sir, motion sickness? When you sit in a car or a bus, after sometimes many sensitive people, they have vomiting. Why? Because जब हम कार में बैठते हैं, हमारा सिर घूमता है. When our head rotates, the semicircular canals in our ear, it will also rotate. The endolymph which is present also rotate, and this endolymph stimulates vestibular nerves. And the endolymph stimulates vestibular nerve. Vestibular nerve goes to cerebellum. Remember, auditory nerve, temporal lobe. Vestibular nerve, cerebellum, to maintain balance. And from cerebellum, the nerves goes to CTZ area. Sir, what is CTZ area? Chemoreceptor trigger zone. What is this, sir? This is the vomiting center of the brain. So it leads to nausea and vomiting. So what is motion sickness? We have discussed motion sickness in 15 seconds. This is simply motion sickness. Now the basic question arises, sir, why vestibular nerves are getting stimulated? Sir, vestibular nerves are getting stimulated because it contains receptors on it. Vestibular nerves contain muscarinic 1 receptor, and it contains histaminic 1 receptor. When it gets stimulated, it leads to carrying of impulse to cerebellum and CTZ area, which leads to nausea and vomiting. Now the question is, which drugs are given in the treatment of motion sickness? In the treatment of motion sickness, we give anti-muscarinic drug. And which anti-muscarinic drug is given? Sir, hyoscine. And this hyoscine is considered to be the drug of choice. Now, can you tell me, apart from anti-muscarinic, which other class of drugs you can give for the treatment of motion sickness? The answer is antihistaminic drugs. Very good. Many students have answered. It means your preparations are going very nicely. Now remember, all these drugs which we have written are antihistaminic drug. But one point again, additional point, free ka point, these are first generation antihistaminic. Because only first generation antihistaminic can enter into the brain. They can cross blood-brain barrier, and inner ear or vestibule is a part of brain. It is not the part of ear, it is the part of brain. Now the question is, which drug can be given? Which drug can be given? Now I am seeing your chats. Now which drug can be given as a transdermal patch for motion sickness? Is it promethazine, cinnarizine? The answer is diphenhydramine. And this question, believe me, have been asked more than 5 times. 5 बार से याद आ चुका है सवाल. Okay? So this was a tricky one, I told you before. पहले बता दिया था tricky one है. So the answer is diphenhydramine. But don't worry, let's have a list of drugs which are given as a transdermal patch. So let's write the list. Can you tell me which drug for smoking cessation is given as a transdermal patch? Nicotine patch, है ना? The most effective drug for smoking cessation, nicotine patch. What are the other drugs? We will see in a follow-up question. Hyoscine, another name is scopolamine, which is an anti-muscarinic drug, and diphenhydramine, which is an antihistaminic drug. These two drugs are given for motion sickness. Nitrates. Nitrates are given in angina because transdermal patch is a long-acting route. It is given for chronic treatment of angina. But bachcha log, anyone who can answer me, if I will write a word sublingual nitrate, do you think sublingual nitrate is a fast-acting route? No, sir. It is a very, is it a slow-acting or a fast-acting route? Sublingual is a very fast-acting route. It is the only drug we have for acute attack of angina. Remember, transdermal patch for prevention or chronic angina, sublingual nitrate for acute attack of angina because sublingual route is a fast acting route. Clonidine for hypertension. Salicyline, the only drug we have for depression as a transdermal patch is salicyline. Rivastigmine, Alzheimer's disease. Why, sir? Why we have to make rivastigmine for Alzheimer? The person has habit of forgetfulness. The person will not take medicine. Better to make a transdermal patch, rivastigmine. Similarly, for Parkinson disease, rotigotin. Parkinson disease, where we apply? Parkinson's disease, we apply on cranium. So it's a transcranial patch. We apply on the skin of cranium, not hair generally. Nicotine is applied here, but transcranial patches of rotigotin. Similarly, estrogen and progesterone, natural hormones, when given orally are not absorbed, high first pass metabolism, but they can be given as a transdermal patch as a hormone replacement therapy. Hormone replacement therapy means when there is deficiency of estrogen and progesterone. In which age group in female there is deficiency of estrogen and progesterone? Postmenopausal female. Postmenopausal female, ovaries are not working. They have deficiency of estrogen and progesterone. Apply a patch of estrogen and progesterone. Done? Let's move ahead. Next question. Now this is a question of pharmacokinetics. Sir, best measure of rate of absorption. Now bachcha log, just imagine you have taken a drug orally. This drug comes into your GIT and slowly it will come into the blood and it will have some concentration in the blood. Agreed? So if we make a graph, the concentration of the drug in plasma with time. सर सारा का सारा ड्रग एकदम थोड़ी ना आ जाएगा, ड्रग टाइम के साथ आता है. सो कैन वी से व्हेन यू गिव अ ड्रग ओरली, slowly and slowly the drug will come into the blood and slowly it will be removed out of the blood. So this is the graph which we make as a concentration time graph. So in pharmacokinetic, when we talk about absorption, we make a graph, concentration time graph. The full concept we will see later on. Now, just sir, tell me, suppose this is a drug A. Now, this person has taken another drug. Let's say that drug is B. This drug is coming into the blood like this. Okay. Now, can we say this is the Cmax of A? Cmax means the maximum concentration A achieves in blood. This is the Cmax of B, which is the maximum concentration B achieves in the blood. Can we say this maximum concentration is achieved in this time? Let's call it as Tmax. And the Tmax of B is this much. Now, bachcha log, I have made a graph for you. Can you tell me a simple answer first? Which drug is coming rapidly into the blood? कौन सा ड्रग जल्दी ब्लड में आ रहा है when you have taken orally? Is it A or is it B? Is it A or is it B? What is your answer? The drug A is coming rapidly into the blood. The drug B is coming. When you talk about speed, speed means rate. Rate means time. So by which parameter we have calculated the rate of absorption? It is time. Time means speed, time means rate. So Tmax tells you about the rate of absorption. So rate of absorption is by Tmax. Now my second question, which drug tells you about the maximum concentration achieved in blood? Which parameter among Cmax and Tmax tells you about the maximum concentration achieved in blood? Cmax. Very good. Agreed. And lastly, can you tell me the total amount of drug which is coming into the blood? Can we say is this much? This is A. This is the area under curve of A. Area under curve of A means this is the total amount of drug which is coming into the blood with the time. So AUC tells you about the total extent of absorption. AUC tells you about the total extent of absorption, that is AUC, area under the curve. So remember, rate of absorption Tmax, maximum concentration Cmax, total extent of absorption, which is a separate question which was asked earlier, is AUC. AUC is area under the curve. So the answer for this question is Tmax. Agreed? Let's come to the next question. So this is the slide which you can have. Okay. Chaliye, let's come to the next question and let's try to answer it. So this is an additional point in which drug we do hemodialysis. Just remember the list: blast. And in which drugs we don't do hemodialysis, that is avoid, ABC. Another one-liner: which drug deposit in retina and cause bullseye retinopathy? Why bullseye? Because chloroquine deposits like concentric rings in retina, which looks like a shooting board. The shooting board is known as bullseye. So which drug causes bullseye retinopathy? Chloroquine. These are the one-liner MCQs which you must remember. Let's move ahead. Shabash. Now, try to answer this question. It's a factual question. इसमें concept नहीं है. There is no concept in this question. So try to answer which of the following is not a prodrug. What are prodrug? Prodrugs are inactive drug and they get converted into active form in our body. Okay. So what is the answer? So mycophenolate mofetil, yes, it is a prodrug. Its active form is mycophenolate. इट्स एक्टिव फॉर्म इज माइकोफिनोलेट, मॉफिटिल वर्ड हटा दोगे, एक्टिव फॉर्म बन जाएगी. Enalapril, true, it is a prodrug. Remember, pril means any drug which ends with the word pril is an ACE inhibitor, and their active form is prilat. So active form of enalapril is enalaprilat. Carbimazole, yes, it is a prodrug. Its active form is another anti-thyroid drug, that is methimazole. So what is the answer? The answer for our question is Primidone, question of INI-CET 2020. So the answer is C. So sir, what is Primidone? Primidone is an active drug and it forms another active form. The active form of Primidone is phenobarbital. Now, can you tell me, sir, that Primidone is also making an active form? Remember, prodrug means prodrug, they themselves are inactive drug. Okay, Primidone is an example of active drug into active metabolite. Understood this point? Very good, शाबाश. तो अगर ड्रग पहले से एक्टिव है तो वो प्रोड्रग नहीं होगा. तो सर, हाउ वी कैन रिमेंबर द लिस्ट ऑफ प्रोड्रग्स? लेट्स मेक अ निमोनिक. Mnemonic is plasma. These are the list of prodrug you have to remember for exam. Plasma CC. याद कर लो, plasma CC. P for prednisone. Prednisone is a prodrug. It's a corticosteroid. सर, इसकी एक्टिव फॉर्म क्या है? इसकी एक्टिव फॉर्म है prednisolone. याद नहीं करना. You don't have to remember. Just for your knowledge, I am telling. Levodopa. We all know levodopa enters into brain, convert into dopamine. Parkinson disease, deficiency of dopamine, drug of choice, levodopa. We all know. ACE inhibitor ends with the word pril. Any ACE inhibitor which is ending with the word pril, its active form is prilat. Its active form is prilat. If I'll ask you a question, sir, what is the active form of fosinopril? You will straight away tell the answer, fosinoprilat. Enalapril, enalaprilat. But the very important question is, sir, there are two ACE inhibitors which are not prodrug. So this is a very frequently asked question. Sir, कौन से दो ACE inhibitor prodrug नहीं है? There are only two ACE inhibitor which are not prodrug. That is captopril and lisinopril. Rest all other ACE inhibitors are prodrug. Captopril and lisinopril are not prodrug. याद रखना है, भूलना नहीं है. Mycophenolate mofetil, we know. Acyclovir, vir means virus वाला, herpes virus. Carbimazole, clopidogrel and prasugrel. Grel word आता है antiplatelet, we will see. ठीक है, grel word antiplatelet. शाबाश. चलो आगे बढ़ते हैं. Now, a conceptual question. A patient of ischemic stroke. Remember, stroke occurs when there is blockage of blood vessels, cerebral arteries by platelets. Hence, in the treatment of stroke, we give antiplatelet drug. And this clopidogrel, which is written, is an antiplatelet drug. Just now we discussed clopidogrel was prodrug also. Okay. But still after 6 months, the patient had another attack of stroke. Genetic deficiency of which enzyme is responsible for failure of clopidogrel therapy? Anyone? Anyone? Very good. Shabash. I think you all are well read. So this question is coming repetitively from past 5 years in all pattern of exam. It will be a crime if you don't remember this answer. Remember, ये याद करके जाना है. It's very likelihood again this question will come because it is coming regularly from past 5 years. So the answer is CYP2C19. Now what does it mean? Let's see. Remember, CYP enzymes are required for conversion of prodrugs into active form. Agreed? And clopidogrel is a prodrug. We just discussed, that means it is inactive drug. It gets converted into active antiplatelet drug by CYP2C19. So the problem is, some people, they have mutant form of this enzyme, that is CYP2C19. In those people, CYP2C19 doesn't work. Clopidogrel will not be converted into active form. Active form में convert नहीं होगा तो क्या होगा? Again stroke हो जाएगा. So this is the meaning. So if this enzyme shows genetic polymorphism, clopidogrel will not be converted into active form. Now I want to ask you one question. बच्चा लोग try to answer. Sir, clopidogrel is an antiplatelet drug. Can you think logically what should be the side effect of all antiplatelet drug? बताओ बच्चा लोग, क्या आप बता सकते हो? एंटीप्लेटलेट ड्रग देंगे, व्हाट इज द कॉमन साइड इफेक्ट ऑफ ऑल एंटीप्लेटलेट ड्रग? लेट्स सी हु कैन आंसर इट, देन आई विल टेल यू अनदर इंपॉर्टेंट क्वेश्चन. यस, क्रिस्टीना जॉय, वेरी गुड. भारत, वेरी नाइस. ब्लीडिंग, सिंपल सी बात है, ब्लीडिंग है. एंड सर, द साइड इफेक्ट ऑफ क्लोपिडोग्रेल इज गैस्ट्रिक ब्लीडिंग. वेरी गुड. चलो, अब एक बात बताओ साहब, स्टमक में ब्लीडिंग होना इज वेरी कॉमन बिकॉज एसिड इज डिस्ट्रॉइंग स्टमक. Can you tell me if there is gastric bleeding, which drug you will give to protect stomach? Which drug you will give to protect the person from gastric bleeding? What is the drug of choice for peptic ulcer? Any peptic ulcer. Antiplatelet drug induced, NSAID induced, Helicobacter pylori induced, Zolliker-Ellison syndrome. Yes, shabash, PPI. PPI, very good. PPI. Can you tell me one PPI? Omeprazole. Now sir, there is a big problem. The big problem is omeprazole inhibits CYP2C19. Omeprazole inhibits CYP2C19. Sir, as a doctor, when you will grow in your career, remember, when you will be prescribing antiplatelet, you will be prescribing PPIs also. My question from you people is, would you prescribe omeprazole with clopidogrel? Would you like to prescribe omeprazole with clopidogrel? The answer is do not combine. Don't combine omeprazole with clopidogrel. Reason? Shabash, खत्म हो गया. This question has been asked many times. चलो आगे बढ़े. Fine, all are fine. समझ आ रहा है, आगे बढ़े. Any problem? कुछ नहीं समझ आ रहा? Ask me the question. ठीक है? शाबाश. चलो. So, sir, what are the different drugs which are the substrates or the drugs which are metabolized by different CYP? Sir, this list is very important. This list is very important. And now I will tell you the tricks how to remember. Sir, first type of CYP is CYP1A2. Sir, इसमें A आ रहा है. A मतलब एस्थमा. एस्थमा में कोई ड्रग जो यूज होता है, जो चाय और कॉफी में भी मिलता है. Any drug for asthma drug which is also found in tea and coffee, theophylline. So remember, theophylline is metabolized by CYP1A2. This is a trick how to remember. Okay? Okay? Now, CYP2C19. CYP2C19. How to remember, sir? Sir, this CYP2C9, sorry, I'm really sorry, it is present in least quantity in our body. It is present in least quantity in our body. So, which drugs are metabolized? Let's say I will give you a trick. First is phenytoin. Second is warfarin. ये दो याद रखने हैं. Now, sir, just imagine if I will give higher dose of phenytoin in my patient, or if I will give higher dose of warfarin in my patient, can we say these enzymes will become saturated? ये तो saturate हो जाएंगे because this CYP is present in very less quantity in our body. So can we say phenytoin and warfarin will accumulate in the body? That is why phenytoin and warfarin, they show saturation, which is also known as zero order kinetics. It shows saturation or zero order kinetic. Why? Because they are degraded by CYP2C9. 2C9 is present in least quantity in our body. If you give higher dose of phenytoin, it will be very good. So this is another question you have answered. CYP2C19. Don't confuse between C9 and C19. This is the area जहां पे आपको confuse किया जाता है. So remember a mnemonic CAP. CAP CAP. CAP stands for clopidogrel. Azoles, any azoles. Azoles are antifungal. Ketoconazole, voriconazole, itraconazole, eniazole, CYP2C9 and PPI-prazole. We just discussed PPI. शाबाश. आगे चलें. नेक्स्ट CYP2D6. बेटा डी पे आते हैं यार. अब क्या करें, डी आता है तो दिल आ जाता है सामने, है ना. तो एक दिल और दिमाग वाले ड्रग, दिल पे जो काम करते हैं, दिमाग पे जो काम करते हैं, वो डी से मेटाबोलाइज होते हैं. दिल पे कैन वी से बीटा ब्लॉकर लाइक प्रोपेनेलॉल इज मेटाबोलाइज्ड बाय दिल पे काम करने वाला बीटा 1 रिसेप्टर. एंटी एरिथमिक, दिल पे काम करने वाले. सर दिमाग पे काम करने वाले कोई ड्रग बता सकते हो दिमाग पे काम करने वाले? एंटी साइकोटिक, हेलोपेरिडोल. एंटी डिप्रेसेंट, डिप्रेशन भी दिमाग में ही होता है ना साहब, कहीं और तो नहीं होता ना इधर उधर, है ना. लाइक TCA, SSRI एंड ओपियोइड. इससे बढ़िया तो कुछ है ही नहीं जीवन में. ओपियोइड है ना, इंटेंस प्लेजर, ओपियोइड. So it's an easy trick how to remember it. Agreed? Now sir, can you tell me E? E for everyone has eaten this drug. E means everyone has eaten this drug. सबने जीवन में ये ड्रग खाया है. Everyone in their lifetime has eaten this drug. So what is the name? What is the name? What is the name? I'm asking. Arey shabash Avinash ji. It is paracetamol. It's a very commonly asked question. Jokes apart, I'm just making the mood light. Okay. So everyone even. So I hope you can remember a little bit about of these tricks because otherwise it will be a difficult thing to remember. तो tricks बनाओ, concepts बनाओ, याद हो जाएगा. आगे बढ़ते हैं. चलो next question. बताओ. An epilepsy patient is taking retigabine. What is retigabine? Let's say it's a new anti-epileptic drug, some potassium cyanide channel opener. We don't care about it. Now phenytoin is added. Sir, phenytoin तो कहीं सुना हुआ है हमने. What should be done next? Anyone who can answer? I'm giving you 3.5 seconds of time. ओके. प्रदीप कह रहे हैं डोज ऑफ रेटिगाबीन शुड बी इंक्रीज्ड. ओके. मोनिका, सुखबीर, यार सब ए आंसर बोल रहे हो. अब सब ए बोल रहे हो. डेमोक्रेसी है, डेमोक्रेसी के इज आई थिंक वी शुड रिस्पेक्ट डेमोक्रेसी. द आंसर इज ए. द आंसर इज ए. द आंसर, द रीजन इज phenytoin is a CYP enzyme inducer. I will tell you this concept, just write for a moment, and it increase metabolism or degradation of other drugs. So as it increase metabolism or degradation of other drug, dose of other drugs should be increased. Dose of other drugs should be increased. कोई बात नहीं, गलती से ही सीखता है यार हर कोई, है ना. गलती करके ही सीखता है. गलती करना ही is the best university. So let's talk about what do you mean by CYP enzyme inducer and CYP enzyme inhibitor. CYP enzyme inducer, remember they increase metabolism of other drug, hence you have to increase the dose of other drugs which are combined with these drugs. अगर इन ड्रग के साथ आप दूसरे ड्रग कंबाइन करोगे, उनकी डोज बढ़ानी पड़ेगी. यू हैव टू इंक्रीज द डोज ऑफ एनी अदर ड्रग यू आर कंबाइनिंग विद देम. So the answer is GPRS AS. So G for griseofulvin. Fulvin means antifungal. Phenobarbital, phenytoin, carbamazepine, all anti-epileptics are enzyme inducers. Follow-up question, except valproate. So all anti-epileptics are enzyme inducers. Valproate is an enzyme inhibitor. Valproate के साथ उल्टा है. Rifampicin, yes. सेंट जॉन वॉट, सेंट जॉन क्रिश्चियन, क्रिश्चियन कहाँ होते हैं? यूरोपियन होते हैं। यूरोप लोग, यूरोपियन पीपल आर सफरिंग फ्रॉम डिप्रेशन, वेरी डिप्रेस्ड पीपल, hence they eat this plant St. John's wort, and it is used as an antidepressant medication. Lastly, daru and sutta. You become induced with daru, you become induced with sutta. So the answer is alcohol and smoking, they are enzyme inducer. Remember, chronic alcohol is an inducer, acute alcohol is an inhibitor. How to remember? Sir, when I entered into the college, my senior fetched me a beer. I became totally out. But when I became intern, the capacity, now I can drink 5 bottles and nobody can dare to challenge me. That means when we start drinking alcohol, with time, the capacity increases. With time, capacity increases means with time, when you start drinking alcohol, your CYP enzyme becomes induced. And now if you will drink alcohol, it will get rapidly metabolized. इसीलिए कैपेसिटी बढ़ जाती है. तो chronic alcohol is a CYP inducer. Don't worry, don't forget it. Similarly, सर दोस्त ने सुट्टा पीना शुरू कराया. First तो पहला दोस्त ने पिलाया. I was a social smoker. Whenever I call someone, मैं तब पीता था. But now after 5 years, I keep 20 packs of cigarettes in my pocket. I am a chronic smoker. Why? With time, enzymes becomes induced. You will not have the feeling of smoking. Hence, with time, your smoking capacity increases. Smoking is an CYP inducer. Similarly, CYP inhibitor. Remember, CYP inhibitor, the mnemonic is coke, IVC and GAR. Remember, trust me, all drugs have been asked. This is a big mnemonic, but still you have to remember. And remember, if you combine any drug, these CYP enzyme inhibitor, they increase toxicity of other drugs. Hence, you have to reduce the dose of other drug. Okay? So this is the list you remember. Remember, rifampicin was inducer, isoniazid is an inhibitor, but isoniazid is an inducer of CYP2E1. Grapefruit juice, it contains furanocoumarins, which leads to enzyme induction. Let's come to the next question. Okay. So this is the list of drug interaction. You can have a screenshot. The complete concept we will discuss in regular classes. This drug interactions comes very commonly, and this is how the drugs which are metabolized out of the liver, Hoffman elimination, pseudocholinesterase, plasma esterase. This is an important slide. Just have a screenshot of this slide. Let's come to the next question. Antidote for amphetamine poisoning. Antidote for amphetamine poisoning. Tell me. 3.5 seconds. Avinash D. Ajay Chaudhary C. This question has been asked more than 3 times in past 5 years. Paras A. Sagmesh A. I am finding the right answer. Right answer तो बोल दो. A बोल दिया, C बोल दिया, D बोल दिया, तो right answer क्या हुआ? No democracy here. So the answer is autocracy or monarchy. The answer is ammonium chloride. Okay? The answer is ammonium chloride. Ammonium chloride is the correct answer. And I will tell you the reason for it now so that you will never forget it. It has been asked many times. So the main reason is, remember, if there is an acidic drug, we change the pH of urine alkaline, because acidic drug in alkaline urine becomes water soluble and they get excreted out in urine. Similarly, sir, if there is a basic drug we turn the pH of urine acidic. So whatever the drug is, turn the pH of urine opposite to that of drug. In opposite pH, the drug becomes water soluble. Water soluble drugs are excreted out in urine. So remember, we do forced alkaline diuresis in case of poisoning of which drug? In case of weak acidic drug poisoning. And how we do it? By giving a drug sodium bicarbonate. And sodium bicarbonate is the antidote of aspirin poisoning, because aspirin is an acidic drug. We turn the pH of urine alkaline, it will become more water soluble excreted out in urine. And if the drug is basic, we turn the pH of urine acidic, it will become more water soluble by giving ammonium chloride. And remember, amphetamine is a basic drug. We turn the pH of urine acidic. Very good. Okay? Shabash. So remember now one point. How to remember the name of the drug? Sir, kitne naam? Galib bhi घबरा गया था. Remember, all these drugs are ending with the word "ene." All these drugs are ending with the word "ene." Amphetamine, basic drug. Strychnine, basic drug. Morphine, atropine, quinine. In all these drugs poisoning, we give ammonium chloride. So "ene" word आ रहा है तो basic drug है. यूरिन को एसिडिफाई करेंगे किससे? अमोनियम क्लोराइड से. एम्फेटामिन पॉइजनिंग, द ओनली एंटीडोट वी हैव इज, मन में जोर से बोलो, अमोनियम क्लोराइड. अंडरस्टूड दिस पॉइंट? शाबाश बच्चा. एक वैसी बात बताता हूं, इफ यू आर एम्फेटामिन अब्यूजर्स, व्हाई यू मिक्स एम्फेटामिन इन सोडियम बाइकार्बोनेट? सोचना, एक घर के लिए आपका सवाल है. अगर आप एम्फेटामिन के अब्यूजर हो, आप एम्फेटामिन को सोडियम बाइकार्बोनेट में मिक्स करके क्यों लेते हो? इसका जवाब घर पे सोचिएगा. नाउ लेट्स राइट द एंटीडोट्स ऑफ ऑल ड्रग पॉइजनिंग. वेरी इंपॉर्टेंट स्लाइड. ऑर्गेनोफॉस्फेट एंड कार्बामेट पॉइजनिंग, द एंटीडोट इज एक्ट्रोपिन प्लस ऑक्साइम. बट एक बात याद रखना है, ऑक्साइम्स आर ओनली गिवन इन ओपी पॉइजनिंग. ऑक्साइम्स को हम कार्बामेट में नहीं देते, वर्सनिंग हो जाती है. तो कार्बामेट पॉइजनिंग ओनली एक्ट्रोपिन, ऑर्गेनोफॉस्फेट पॉइजनिंग एक्ट्रोपिन विद ऑक्साइम. ओ फॉर ऑक्साइम, ओ फॉर ओनली ओपी पॉइजनिंग. एक्ट्रोपिन पॉइजनिंग, धतुरा पॉइजनिंग, बेलाडोना पॉइजनिंग, तीनों एक ही चीज है. एग्रीड? तो अगर एक्ट्रोपिन को आप ऑर्गेनोफॉस्फेट पॉइजनिंग में दे रहे हो, तो एक्ट्रोपिन पॉइजनिंग में क्या दोगे? एक्ट्रोपिन पॉइजनिंग में वी गिव वन ड्रग फीजोस्टिग्मीन. फीजोस्टिग्मीन इज अ कार्बामेट. तो रिमेंबर, कार्बामेट पॉइजनिंग में हम देते हैं एक्ट्रोपिन, एक्ट्रोपिन पॉइजनिंग में हम देते हैं कार्बामेट. ऑपोजिट हो गए दोनों. डाइजॉक्सिन पॉइजनिंग, डिजीबाइंड. डिजीबाइंड इज एन एंटीबॉडी अगेंस्ट डाइजॉक्सिन. एंटीबॉडी अगेंस्ट डाइजॉक्सिन. इट्स एन ऑर्फन ड्रग, मिलता नहीं है. ट्राइसाइक्लिक एंटीडिप्रेसेंट पॉइजनिंग, लास्ट ईयर क्वेश्चन, सोडियम बाइकार्बोनेट. अब बच्चा लोग कौन मुझे बताएगा क्यों? वाई सोडियम बाइकार्बोनेट? ट्राइसाइक्लिक एंटीडिप्रेसेंट पॉइजनिंग, यूरिन में एक्सक्रीट आउट कराना है. बट एड लिग्नोकेन if the patient is having arrhythmia. Now sir, last year question was, what is the drug of choice for tricyclic antidepressant poisoning? Both sodium bicarbonate and lignocaine was given. Can you tell me आप किसके साथ जाना चाहोगे? अगर दोनों ऑप्शंस हैं तो किसके साथ जाओगे? You will always go with sodium bicarbonate. Lignocaine we only give if there is arrhythmia. Understood this point? Beta blocker, a very peculiar antidote, शायद हमने सोचा भी नहीं था. Glucagon hormone, because beta blocker reduce heart rate, glucagon increase heart rate. Benzodiazepine poisoning, flumazenil. Don't forget this word, flumazenil. Flumazenil. Cyanide poisoning, sir, which vitamin is the antidote of cyanide poisoning? I have given you the hint. Which vitamin is the antidote of cyanide poisoning? क्योंकि उससे सायानोकोबालामीन बन जाता है. B12, हाइड्रोक्सीकोबालामीन. ठीक है बच्चा, भूलना नहीं है. ओपियोइड पॉइजनिंग, नैलोक्सोन. क्योंकि नैलोक्सोन आईवी दिया जाता है. इसका एक भाई भी होता है, देयर इज अ ब्रदर, नैल्ट्रिक्सोन. वो नहीं, नैलोक्सोन. इथाइलिन ग्लाइकोल पॉइजनिंग और मिथेनॉल पॉइजनिंग. रिसेंटली सम चिल्ड्रन डाइड इन अफ्रीका. दे वर कंज्यूमिंग कफ सिरप. व्हाई? इट वाज कंटेनिंग इथाइलिन ग्लाइकोल. Just imagine those African children, their plight. If you were there, which antidote you will give to those African children who died because of cough syrup having ethylene glycol poison in them? The answer is fomepizole. Shabash. Very good. You all are writing. But remember, फोमिपिजोल इज एन ऑर्फन ड्रग, मिलता नहीं है. इथाइलिन ग्लाइकॉल एंड अ मिथेनॉल पॉइजनिंग इज एन इंडिकेशन वेयर यू कैन ड्रिंक विद योर पेशेंट. 2 पेग पेशेंट को, 2 पेग मेरे, दोनों पियो बैठ के. सो यू कैन गिव इथेनॉल to saturate the enzymes in cases of, but antidote you will always go first with fomepizole is the drug of choice because it is not available in India, most of the parts of India. Hence we give ethanol, McDowell 100 piper 30 ml, ethylene glycol and methanol poisoning. शाबाश, आगे बात करते हैं. Now this we have discussed. चलो बच्चा लोग, another antidote, remember it's a very commonly asked question and I am predicting that this year also, probably it is INI-CET or NEET or FMGE, this question will come again. High chances. Antidote for anticoagulant drug. It is important to make because they can cause bleeding. So we should have antidote for anticoagulant drug. So tell me the answer. Let's see who can answer. Let's see who can answer. 3.5 seconds. Don't forget this number, 3.5 seconds all anytime. Yes, you all are right. Very good. Shabash. So the answer is Siraparentac. ठीक है? The answer is Siraparentac. Very good. Okay. I will tell you about this drug shortly. So just this is the antidote. Let's write antidotes for all. Sir, warfarin. Warfarin is a vitamin K inhibitor. It inhibits 2, 7, 9 and 10 clotting factor. So think logically, what should be the antidote for warfarin? The antidote for warfarin is vitamin K1, which is also known as phytonadione. Now, bachcha log, see these two drugs, apixaban, rivaroxaban. I have marked one point for you and tell me which clotting factor apixaban and rivaroxaban inhibit. Anyone? Which clotting factor apixaban and rivaroxaban inhibit? कौन से क्लॉटिंग फैक्टर को एपिक्साबैन एंड रिवारोक्साबैन इनहिबिट करते हैं? शाबाश, दे इनहिबिट विटामिन क्लॉटिंग फैक्टर 10A. सो व्हाट शुड बी द लॉजिकल एंटीडोट फॉर एपिक्साबैन एंड रिवारोक्साबैन? गिव recombinant form of factor 10A as antidote, and the name of the drug is Andexanet. ये कैसे याद करें? Who will tell me a trick? Now you know. Alpha. Alpha means active. Dexa means 10. Dexa means 10. Andexanet alpha is an antidote of apixaban and rivaroxaban. I hope कभी नहीं भूलोगे. Dabigatran. चलो, first I will write the answer, then I will give you the trick. Idarucizumab. Mab means monoclonal antibody. It's a monoclonal antibody against dabigatran. Sir, a very peculiar point. This is the only monoclonal antibody, a very scientific statement I am going to make, which contains daru in it. It is the only monoclonal antibody which contains daru in it. And dabi. Dabi means daba ke daru piyo. Daba ke daru piyo means, daba ke means dabigatran. Daru piyo matlab idarucizumab. Don't forget it. High molecular weight heparin, protamine sulfate. Protamine sulfate is only for high molecular weight heparin. Remember, it is not for ultra low molecular weight or low molecular weight. It is only for high molecular weight heparin. Remember, any molecule which ends with the word perinux is ultra low molecular weight heparin. Perinux word आता है तो ultra low molecular weight heparin. No antidote. Hiriudin, bivalirudin, they are direct thrombin inhibitor. No antidote. That is why rarely used. Okay, sir, we don't have any antidote for idraperinux. Yes, we don't have. But what we do, we attach biotin to it. हमने biotin attach कर दिया. क्या drug बन गया? idrabiotaperinux. इसकी antidote है sir. For this we have an antidote. The antidote is avidin. The antidote we have is avidin, because avidin binds to biotin. Let's come to the next question. In first order kinetics, if drug dose is doubled, conceptual question, then what happens? 3.5 seconds. Yes, biotin, evident, PSM question, raw egg, shabash. That is why we should boil our eggs. Don't take it that way, okay? In first order kinetic, if the drug dose is doubled, what happens? Half-life is doubled, half-life is unchanged, plasma concentration and half-life doubles, plasma concentration and half-life. Anyone? The answer is B. Okay. I know it's a tricky one, but remember this question was asked in INI-CET 2021. And I will make you understand what is first order and zero order in 2 or 3 minutes. Okay. Okay. So half-life remains unchanged. So I've told you the answer. The answer is B. The answer is B. Let's see. Don't worry. If you don't understand, abhi samajh aa jayega. Now, sir, what is first order kinetic? Imagine you are very capable person. Okay. Your capacity to remove a drug is very high. Capacity to remove a drug is known as clearance. Sir, if you have very good capacity to remove a drug, let's say if I have given you 100 milligram of the drug, normally in 2 minutes, let's say 50 milligram is eliminated. Can you tell me if I will give you 200 milligram of the drug in 2 minutes, how much drug will be eliminated? 100. Why, sir? Because your body has very good capacity to remove a drug. So it means as I will increase the dose, as I will increase the concentration in the body, there will be increase in elimination. मैं ज्यादा ड्रग दूंगा, ज्यादा ड्रग बॉडी बाहर निकालेगी. Why? Your clearance capacity is very high. This is first order kinetics. So my question from you people is, can we say, is elimination directly proportional to plasma concentration? So in first order kinetic, elimination is directly proportional to plasma concentration. More plasma concentration, more elimination. Every time 50% of the drug is getting removed in 2 minutes. So a constant fraction, that is 50%, is eliminated. Agreed? Now can you tell me 200 का 100 करने में, 100 का 50 करने में कितना टाइम लगा? How much time? Only 2 minutes. So the half-life of a drug remains constant. So this was the question. Half-life of a drug remains constant, and most drugs they show zero first. What in zero order? Sir, in zero order, when I will give a drug, let's say 100, sir, only 10 will be eliminated. Only 10 will be eliminated. Sir, इससे ज़्यादा निकलेगा ही नहीं. It doesn't have much capacity. So if I will increase the dose, here the elimination is constant. A constant amount, that is 10 milligram, is eliminated. Why? Because the clearance capacity is very low. Your body doesn't have capacity to remove a drug. It can only remove 10 milligram. And half-life is directly proportional to plasma concentration. More drug in plasma, more time it will take to become half. Agreed? And very few drugs they show zero order kinetics. So if I will make concentration time graph, in first order it is exponential decrease. Exponential decrease means 100 ka 50, 50 ka 25, 25 ka 12.5. This is how the drug reduces. In zero order kinetic, there is linear decrease. 100 ka 90, 90 ka 80, 80 ka 70. This is your zero order kinetic. As simple as that. Okay. Very few drugs they show zero order kinetic. Which drug shows zero order kinetic? Mnemonic is WhatsApp. The mnemonic is WhatsApp, and try to remember at least ATP. ये तीन तो याद रखने ही रखने हैं. ATP. And it is a very commonly asked question. Alcohol, theophylline and phenytoin. Agreed? So it's an old question but a gold question. Remember, alcohol only shows pure zero order kinetics. It doesn't show first order kinetic. Phenytoin shows zero order and some pseudo zero order. What is that? We will not go into that concept right now. For a moment, cram it pseudo. Pseudo means p phenytoin. So बच्चा लोग, alcohol only shows zero order kinetic. That means 30 ml डालो, मस्त चढ़ेगी. The life is good because our body doesn't have capacity to remove alcohol. So it is a gift from the God to us that it doesn't have capacity. Alcohol produce very beautiful effect in 30 ml. Okay, but it doesn't mean you should consume alcohol. Okay. Now this was a question which was recently asked last year. Identify the types of agonist and antagonist on dose response curve. Now remember, if you see this blue line, this drug is producing 100% of the response. 100% means full agonist. Second drug, you can see it is producing, let's say, less than 100 or 50% of the response. Thoda kam ho raha hai, partial agonist. This came. And I will tell you which question was there. There is a drug which is producing opposite response. The things are getting reduced. So the name will be inverse agonist. So agonist means any response is produced. It can be full, partial or inverse. Now just give a drug. It will just block the receptor, but no change in effect will occur. If there is no change in the effect, it is known as antagonist. Remember, antagonists do not produce any effect. Agreed? So the question came, which of the following is antagonist and inverse agonist? ये बात आपसे पूछी गई थी, ठीक है? ये बात आपसे पूछी गई थी. It was a question of your NEET, not INI-CET 2021. Okay? So some examples of inverse agonist. Tiprolizant किस पे inverse agonist है? H3 histamine पे. Rimonabant, monadarling, cannabinoid receptor. Beta carbolin, GABA A receptor. Cram these three words. They have been asked. Let's jump to the next question. आ जाओ बेटा. So this is now, let's talk antagonist a little bit more. थोड़ा antagonist के बारे में और बात करते हैं. There are two types of antagonist. Competitive, which will block the same site, same receptor where agonist bind. Non-competitive, bind to some different site. Remember, this is an agonist. Let's say this is the graph of agonist. We know that agonist produce effect. Let's suppose this is a full agonist. Let's suppose this blue line is a full agonist, which is producing an effect. The maximum response produced by full agonist is known as Vmax. Vmax is the maximum response produced by full agonist. But sir, at which dose? That dose is known as Km. Km is 50% of the effect is produced by which dose? Okay, so this is now full agonist. Now in this full agonist, you added an antagonist. आपने एक antagonist add कर दिया. It could be competitive, it could be non-competitive. You don't know right now. In first case, same response is produced. Same response is produced, but you have to increase the dose of agonist. आपको agonist की dose बढ़ानी पड़ी, तब जाके पूरा response आया in the presence of antagonist. In second case, it is no change. There is permanent decrease in response, B. So I have given you two antagonists, A and B. Can you tell me among A and B, which is competitive, competition वाला, which is no competitive, competition खत्म, permanently खत्म, हो ही नहीं सकता competition, anyone? So red is, yes, red or pink is competitive antagonist, green is your non-competitive antagonist. Remember it. Now see the follow-up question. This question has been asked in 2021, 2022, all 3 years. ये तीनों साल आया है सवाल. It's a very favorite question. Can you tell me in which antagonist the Vmax will remain same? Vmax change किस में नहीं हो रहा? पहले जैसा ही है. Vmax किस में change नहीं हो रहा? In competitive antagonist, there is no change in Vmax and there is a right parallel shift of DRC. DRC is dose response curve. Agreed? But sir, क्या हमें agonist की dose कम देनी पड़ेगी कि ज्यादा देनी पड़ेगी to produce that same level of response? Sir, ज्यादा देनी पड़ेगी. तो Km और dose is increased. Remember, very commonly asked. Non-competitive, permanent decrease in height or slope. Vmax is reduced. Dose बढ़ाने का कोई फायदा नहीं. The KM will not change because there is no competition. खत्म. Remember this point. Very commonly asked MCQ. Very, very commonly. Let's jump to the next question. Therapeutic index is a measure of anyone. 3.5 seconds. 3.5 seconds. 3.5 seconds. करो करो करो. वेरी गुड. कहीं ए कह रहे हैं, कहीं सी कह रहे हैं. अविनाश ए कह रहा है, चौकसक सी कह रहा है. चलो अब सब ए पे आ गए. सो द आंसर इज सेफ्टी मार्जिन. तो जिन बच्चों ने ए आंसर कहा है वो टॉफी खाएंगे आज अपने आप. ठीक है, मैं तो मिल नहीं सकता आपसे. सो द आंसर इज ए. नाउ व्हाट इज थेरेपेटिक इंडेक्स? लेट मी मेक यू अंडरस्टैंड. वेरी सिंपल कंसेप्ट, कभी नहीं भूलना. सर इमेजिन आपने एक ड्रग की डोज बढ़ाई और आपने उस ड्रग का रिस्पॉन्स देखा. यू चेक द रिस्पॉन्स इन पीपल. बहुत सारे लोगों में रिस्पॉन्स देखा. कैन वी से देयर विल बी अ डोज एट विच द ड्रग विल प्रोड्यूस बेनिफिशियल इफेक्ट? लेट्स से एंटी एमिटिक ड्रग दिया, द वॉमिटिंग विल स्टॉप. लेट्स कॉल इट एज ED. ED स्टैंड्स फॉर इफेक्टिव डोज. बट सर आपने डोज बहुत ज्यादा बढ़ा दी. एक डोज के बाद आफ्टर एनी डोज a drug becomes poison. High dose, the drug becomes poison. This is known as toxic dose. Now, anyone who can tell me the full form of ED50? Anyone who can tell me the full form of ED50? Can we say this is ED50? So, what is ED50? ED50 is that dose at which 50% of the people will have beneficial effect. Similarly, who will tell me the full form of TD50? Who will tell me the full form of TD50? TD50 is dose at which 50% of the people will experience a toxic effect. Do you agree? Remember, LD50 was an MCQ of last year FMGE. It was a question of FMGE. What is LD50 or TD50? Remember, TD50 is also known as LD50. It is lethal dose. The dose that produce mortality or death in 50% of the people. Now, remember, what is therapeutic index question? तो ये है हमारा therapeutic index is TD50 upon ED50. What is the value of therapeutic index? TD50 divided by ED50. Now tell me बच्चा लोग, I will give you two option. I will give you two option. I am removing this diagram for you to make you understand even more easier. Can you tell me which drug will have? Can you tell me which drug will have higher value of TD50 and ED50? Which drug will have A or B higher value of therapeutic index? Can you tell me which drug will have higher value of therapeutic index? Anyone? Is it the drug A or the drug B? Which drug will have higher value of therapeutic index? B. Can you tell me in which drug, if you will increase the dose several fold, toxicity will not come easily? कौन सा ड्रग इज अनसेफ, ए और बी? कौन सा ड्रग इज सेफ, ए और बी? टेल मी, इन दोनों में से ए सेफ लग रहा है कि बी सेफ लग रहा है? इसमें हमें बी सेफ लग रहा है, डोज बढ़ाने पे भी टॉक्सिसिटी नहीं आ रही. सो रिमेंबर, इफ द वैल्यू ऑफ थेरेप्यूटिक इंडेक्स इज स्मॉल, द ड्रग इज अनसेफ ड्रग. Hence, therapeutic index value tells you about the safety margin. Shabash. ठीक है? So just by seeing this graph, you can tell whether the drug is unsafe or safe. Smaller value, ED50 and TD50 will be very near to each other. So this is the slide. Remember, we sometime also calculate ED50 to TD50. ED50 to TD50 is known as therapeutic range, blood में. Therapeutic range, and you have to remember the therapeutic range of these drugs which is written in front of you. You can click a photo later on because it's a small session and I want to teach you as maximum as I can. Okay, आगे बढ़ते हैं आप. चलो ये फोटो ले लेंगे. Now tell me the answer of this question. Tell me the answer of this question. Anyone? सब सही हो. Safe is B. Absolutely fine. बढ़िया. चलो. Which of the following in clinical trial RCT with blinding is done? RCT word तो अब हम सब जानते हैं. That is randomized control trial. Blinding doesn't means I will मैं किसी की आंख फोड़ दूंगा, ये नहीं. Blinding means I will not tell the patient whether he is receiving an actual drug or a placebo. Shabash, you all are right. Absolutely. Very good. Very good. Very good. Sab sahi ho. The answer is phase 3. Okay? Chalo. I'll tell you now all clinical trials in 1 or 2 minutes, because clinical trial, one question comes in each and every exam, and this part no other subject will teach you. It's an exclusive topic of pharmacology. Okay? Now, bachcha log, in our country, we do phase 1, phase 2, phase 3 and phase 4 trial. These 4 trial are mandatory. Agreed? We go from 1 to 4. What is clinical trial? Clinical trial is human testing of a drug, and after human testing we approve the drug and the drug comes into market. Clinical trial is human testing. Now we start with phase 1. So you are making a new drug. First the drug will enter into phase 1. Phase 1 is done in healthy volunteers. Agreed? It is open label. Open label means no blinding. कोई भी blind नहीं होगा, सबको पता है क्या चल रहा है. If I am a patient, I know I am receiving which drug. Now tell me, first time you are checking a drug in your healthy volunteer, what you are main concern about? अगर आप पहली बार ड्रग को टेस्ट कर रहे हो, if you are testing the drug for first time, what is more important? Safety और efficacy? ड्रग की सेफ्टी ज्यादा इंपॉर्टेंट है कि ड्रग का इफेक्ट देखना ज्यादा इंपॉर्टेंट है? सबसे पहले बुरा हो ना, अच्छा हो या ना हो, बुरा नहीं होना चाहिए, सेफ्टी. And that is why we check what is the maximum dose a patient can tolerate, maximum tolerable dose. And we check pharmacokinetics, ADME. ADME is absorption, distribution, how a drug is absorbed, how a drug is distributed, how it is metabolized, how it is eliminated. Agreed? Next is phase 2. Now the drug is safe. In phase 2 trial, you will take patient, but in very less number, let's say 500 patient. Now this is RCT with blinding, and we will explore whether the drug is efficacious or not. क्या ड्रग इफेक्टिव है कि नहीं है? सपोज ड्रग इफेक्टिव पाया जा रहा है in 500 patient. Now to confirm it, we will test this drug in thousands of people. So again, phase 3 trial, patient, RCT with blinding. RCT means randomized control trial. In one person I will give my test drug. In another patient I will give a similar looking drug, but it will not contain the actual drug. It is a placebo, fake drug, so that I can compare the results. And I will not tell the patient, I will make him blinding. Otherwise the patient can tell me false result, which is known as bias. And here I can confirm efficacy. Here I will confirm efficacy. I have confirmed everything. Now remember, after phase 3 trial, the drug comes into market. Very commonly asked question. After which phase of clinical trial the drug comes into market? After phase 3 trial, the drug comes into the market. Now millions of people are eating your drug. Don't you think, sir, कोई side effect है, अब सामने आ जाएगा? Agreed? So it will done in patients. You cannot make them blind. No blinding, open label. And we are again checked with concern with safety. So if I want to ask you one question, which phase of clinical trial is known as post? My question from you people is, which phase of clinical trial is known as post-marketing surveillance? Option: phase 1, phase 2, phase 3, phase 4. So the answer is phase 4 trial is done after market approval of a drug. So this is a very frequently asked question. Surveillance matlab nazar rakhna. So this is the summary. You can have this summary as a screenshot and you can later on revise. ठीक है, चलो आगे बढ़े. समझ आ रहा है? समझ आ रहा है तो एक बार हाथ खड़ा करो YouTube पे हाथ खड़ा करो so that I can remember. Okay, chalo. Let's come to the question. The most teratogenic drug. In which disease, which drug is safe, which drug should not be given? ठीक है अविनाश, शाबाश. चलो, hyperthyroidism in pregnancy. The most teratogenic drug is carbimazole. And इसी का भाई, इसी के active form, methimazole. So my question is, safest or drug of choice for hyperthyroidism in pregnancy? Pregnancy में PTU. But remember, if the question is asked, drug of choice in pregnancy, PTU for hyperthyroidism. If trimesters are asked, PTU, drug of choice in first, carbimazole and methimazole, second or third trimester में you can give. Because organ synthesis occurs in first trimester. Thromboembolism, warfarin is contraindicated in pregnancy. The drug of choice for thromboembolism in pregnancy is heparin. So if I'll ask you, abruptio placentae, DIC, APLA syndrome, where thromboembolism occurs, answer is heparin. Simple. Bipolar disorder, most teratogenic drug is last year question, INI-CET 2022 May. That is valproate. Which mood stabilizer given for bipolar disorder should never be given? Valproate. Which is the safest drug for bipolar disorder in pregnancy? Antipsychotic. Similarly, in epilepsy, the most teratogenic anti-epileptic drug again is valproate. What it causes, I will tell you. Safest drug is levetiracetam. This is a very commonly asked question. If levetiracetam is not given in the option, then you will go by lamotrigine, LL. Hypertension. Sir, pril wale drug pregnancy में गलती से नहीं देने. Can you tell me which drugs end with the word pril? Pril wale pregnancy में नहीं देने. Okay? So the drug of choice in pregnancy is labetalol. अगर labetalol option में नहीं है, alpha methyl dopa. Earlier alpha methyl dopa was drug of choice, but now labetalol. Infection, PCM, penicillin, cephalosporin, and macrolide. Macrolide is your erythromycin, azithromycin. Which antibiotics are they are safer. I'm really sorry. I will just, what you will do? Just make it opposite. Make it opposite. ACE inhibitor are, it's fine. Just a moment. I got confused. These are the safer drug. So most teratogenic are fluoroquinolones, aminoglycoside, and tetracycline. They are unsafe. So I am writing again for you. Okay, what teratogenic effect they will produce later on. Morning sickness in pregnancy, we developed thalidomide. And you know that thalidomide is the most teratogenic drug. So what is the drug of choice for nausea and vomiting in pregnancy, which is known as morning sickness? Doxylamine, antihistaminic drug, along with vitamin B6. Along with vitamin B6. Shabash. Okay, no, fluoroquinolone causes bone and cartilage defect in fetus, similar to tetracycline. There is a reason for it because it chelates with calcium like tetracyclines. The reasons, this is not the time of reasoning. This is the time to hathoda marne ka, yaad karne ka. So sir, this is the list and this is an important list. Have a screenshot. Agreed? All these questions have been asked. Phocomelia, Epstein anomaly by lithium, aplasia cutis by carbimazole and methimazole, both equally. So this is the question or list you should have and see on one go before attending your exam. आगे बात करते हैं, ठीक है? Lithium is category D drug. Lithium generally we avoid. unless it is indicated. Okay, we check risk versus benefit ratio, only then we start lithium. Okay, although lithium, किसी ने पूछा ना, because Epstein anomaly can be treated easily. Now this could be a potential question because this year we have our list in India, essential drug list came out this year. So that is why this question becomes important. Sir, what is the essential drug? Very simple. Sir, आपकी country में इतनी सारी बीमारियां, you have so many disease in your country. Just keep this much of medicine. ED is essential drugs. It will take care of majority of disease. Handful of medication which can take care of majority of diseases, essential drugs. Simply, easy. So, what do you think essential drugs should be? They should be safe or unsafe? What do you think? They are taken by millions of people in your country. So, they should be safe. They should be costly or cheaper. Remember, they should be cheap or cost effective. A price which community or people can afford. That is why government reduced the price of essential drug. And they are given for highly prevalent disease. So what is the answer of this question? Never combine essential drugs with other drugs. Never combine with other drugs. When you combine any drug with some other drug, it is known as fixed dose combination. So essential drug should never be combined with other drug. Otherwise, there will be increase in price of that drug. Okay? Shabash. Next question. Paracetamol. आप market में गए. You went to a market. You ask chemist, sir, please give me paracetamol 500 milligram. He gave you paracetamol 500 milligram. But when you tested that drug, it only contained 200 milligram. 300 था ही नहीं. Which of the following category of counterfeit drug? क्योंकि you are cheated. You have been cheated by a manufacturer. Those drugs are known as counterfeit drug. So in which category of counterfeit drug would you like to place? This question has been asked 2-3 times. Last year it came. So I'll give you 3.5 seconds to revise it. So some are saying A spurious, some are saying B misbranded. Vijay Pratap तो बहुत ही कॉन्फिडेंस से misbranded बोल रहे हैं. Some are saying adulterated. चलो, I'll give you a story. You will never forget it. सर, आप पैरासिटामोल 500 मिलीग्राम लेने गए. सर, ये सिप्ला की आती थी, मान के चलते हैं सिप्ला ब्रांड. When you tested this drug, जब आपने चेक किया, it contain 0 paracetamol. And it contains Cipla brand. It contains Cipla brand. Who is making this? This is made by a criminal. Who is making this paracetamol in the balcony or the backyard of your home? In the basement. एक नकली मशीन लगा के पैरासिटामोल बना रहे हैं. This is known as नकली दवाई. नकली दवाई. नकली दवाई means spurious. So spurious medicines, they do not contain any active ingredient. Agreed? Some different person is making to earn money. Now, let's say Cipla has made paracetamol 500 milligram. But when you checked, it contained 200 milligram. Remember, even Cipla is making this drug. And Cipla is making this drug, why? Of low quality. Because of low quality, it is increasing its profit. India में यही big problem है. This is the main problem in India. And this type of drug is known as misbranded. So the answer of our question, who will tell me the answer? Vijay Pratap ji ने बहुत confidence से B बोला था. Applause for him. Okay. Now, adulterated. Adulterated means मिलावट. If anyone understand Hindi. मिलावट. Addition of unapproved excipient which are not approved by our government because they can be harmful. Unethical, there is no word like unethical. Everything is ethical in love and war. Okay? कहानी समझ आ गई? Don't forget. I hope you will never forget it. Jokes apart. नेक्स्ट क्वेश्चन, बताओ भाई, कॉमन सिम्टम्स ऑफ अर्ली मशरूम पॉइजनिंग, 3.5 सेकेंड्स, 3.5 seconds. Common symptoms of early mushroom poisoning. No. Misbranded means the company is making a false claim. It is made by the same company. It's a claim which is never fulfilled. So we classify at misbranded, and by classifying misbranded, we can punish that company. It's a law. Okay. So mushroom poisoning, remember, mushroom, it contains muscarine, early mushroom, and muscarine is a cholinergic drug. Cholinergic means it increases acetylcholine action. Its action is like acetylcholine. Sir, what is the action of acetylcholine in the body? The action of acetylcholine in the body is dumbbells. The action of acetylcholine in the body is dumbbells. So dumbbells means increase all secretions of the body. चलो नीचे से secretion increase करते हैं पहले. D for diarrhea. D for diarrhea. और क्या increase करोगे? Urination. M for meiosis. Can we call meiosis as pinpoint pupil? Bradycardia. Acetylcholine suppresses heart. Bronchospasm. Asthma. E for emesis, increase in secretion. Lacrimation, more secretion. Salivation, more secretion. Sweating, more secretion. Increase all secretions of the body and produce decrease in heart rate. This is the feature of acetylcholine poisoning or muscarine poisoning. Shabash. So the answer comes out to be bradycardia. Very good. Bradycardia. Chalo. Okay. Next question. Drug not approved for smoking cessation. 3.5 seconds. Yes, stomach cramps because of diarrhea, and diarrhea increased peristalsis can lead to stomach cramps. Excessive muscle contraction can produce pain, spasmodic pain or colicky pain. Yes, you are right. Oh, absolutely fine. Good. Topiramate. So, the drugs which are given for smoking cessation are, let's write a mnemonic for it. The drugs which are given for smoking cessation are, let's write a mnemonic, nicotine, very bad. Nicotine is very bad, we all know. So the drugs which are given for smoking cessation is nicotine as a transdermal patch, chewing gums, lozenges, nasal spray, etc. Varenicline. It's a partial agonist at nicotinic receptor. And one antidepressant, bupropion. So remember this mnemonic, don't forget it. 3 drugs which have been approved for smoking cessation, सुट्टे की आदत छुड़वाने के लिए, nicotine very bad. Okay. Now what about topiramate? The topiramate is not approved, but still used. If a drug is not approved but still used, similarly, chloroquine, not approved for COVID but still given for COVID patient, this type of indication is known as off-label use. So, bachcha log, this is a MCQ. What do you mean by off-label use? Off-label use means the drug which has not been approved but still prescribed by the doctor because it shows beneficial effect is off-label use. I hope you have understood. Okay? चलो आगे बात करें. Off-label, जहर. आज सारी जहर की बात होगी. Now, continuous inhalational nitric oxide inhalation is given for which disease? Question of 2021. INI-CET 2021. बताओ बच्चा लोग. 3.5 seconds are over, I believe. So, very good. Pulmonary artery hypertension. Sir, what are the drugs we give for pulmonary artery hypertension? Very small topic, but very important topic for INI-CET. चलो सारे ड्रग लिख लें एक ही बार में. So let's write all the drugs for pulmonary artery hypertension. Before writing the drug, can you tell me which brand of cold drink do you like? कोल्ड ड्रिंक का कौन सा ब्रांड अच्छा लगता है? बताओ. पेप्सी अच्छा लगता है कि कोका कोला? चलो पहले पेप्सी लिखेंगे. रीड अबाउट पेप्सी पैराडॉक्स. जब आंख खोल के पीते हो तो कोका कोला अच्छा लगता है, बंद करके पीते हो आंख तो पेप्सी अच्छा लगता है. दिस इज अ साइंटिफिक फैक्ट. ये मुफ्त का ज्ञान है आज का, एग्जाम में नहीं आएगा. पेप्सी पैराडॉक्स. ठीक है, चलो. So this is the mnemonic drugs for PAH. First is P. I will little bit maximize the slide so that you can remember. Drugs for PAH. First is prostaglandin I2 analogs. That is treprostinil, eloprost. How we can remember? Prost word आ रहा है साहब, तो prostaglandin होगा. They are the drug of choice for PAH. Second drug, very important, बहुत बार पूछा गया है, एंडोथिलिन एंटागनिस्ट. एंडोथिलिन को ब्लॉक करने वाला बोसेंटान. very very commonly asked question, etc. All drugs will end with the word entan. Okay, one drug which is the drug of choice for impotence to make your love life very good comes with the brand name Viagra, but also used in pulmonary artery hypertension, that is sildenafil. Sildenafil is given for impotence as well as pulmonary artery hypertension. Soluble guanylyl cyclase activator, Riociguat. Agreed? I2 type of prostaglandin receptor agonist. It is not prostaglandin, but it will stimulate the receptor of prostaglandin. Selexipag, very cheap drug. 6-month cost is 1.5 crore rupees. Now the point is how we can remember P for prostaglandin, I for I type. So I type I. P for prostaglandin, AG for agonist. ठीक है, ये tadalafil will last you long. C for calcium channel blocker like nifedipine, amlodipine. And lastly, the answer of our question, continuous nitric oxide inhalation. Done? Okay, you are doing revision, Shubham. शाबाश, अच्छी बात है. आगे बढ़े. Let's move ahead. चलो आगे बात करते हैं. Paradoxical bronchoconstriction seen with ipratropium. This is INI-CET 2021 May question. Paradoxical bronchoconstriction is seen with ipratropium due to all except. A tough question, but let's see who can answer. It's a tough question. I myself is telling you it's a tough question. And somebody has answered it. Aditya and Pradeep and Pandey has answered it. Very great. This shows how dedicatedly you all guys are working. That's commendable. ऐसे ही पढ़ते रहो. No one can stop you. I can assure you that. The answer is presynaptic. No, answer is D. Okay. Now remember, inhaler of ipratropium. Suppose this is inhaler of ipratropium. It contains EDTA and benzalkylonium chloride, which are antibacterial preservatives. And these molecules, they irritate bronchus. Because they irritate bronchus, it can lead to bronchoconstriction. Okay. Now, in a bronchus, we have vagus nerve. On vagus nerve, we have M2 receptor. On bronchus, we have M3 receptor. Now remember, if you block M3, it causes bronchodilation. And if you block M2, It leads to more release of acetylcholine and causes bronchospasm or bronchoconstriction. So now tell me, what is the answer? So the answer is D. So ipratropium blocks presynaptic M2 receptor on vagus because vagus is coming first. It also blocks postsynaptic M3 receptor on bronchus. But which blockage will lead to bronchoconstriction? It is presynaptic. More concept later on. Drug approved for the treatment of long-term obesity. Anyone? 3.5 seconds. Drug approved for the treatment of long-term obesity. Very good. Shabash. The answer is liraglutide. So remember, these two drugs have been banned. They were approved for the treatment of obesity, but they have been banned because they were causing cardiac valve damage, both. Metformin, although it causes weight loss, but it is not approved. Okay, it is not approved. Liraglutide has been approved and it causes more weight loss as compared to metformin. Okay, so the answer is C. So what are the drugs we have which are anti-obesity drug which have been approved for treatment of obesity? कौन से drug obesity के लिए approved हैं? Let's write the names of those drugs. The first is GLP-1 analog. GLP-1 stands for glucagon-like peptide. They are used in diabetes. So injections of liraglutide, or you can give oral semaglutide. Second drug is, we will write phentermine. Phentermine is a sympathetic drug. Sympathetic means it will suppress appetite. And topiramate. Topiramate is an anti-epileptic drug which causes weight loss. Anti-smoking drug bupropion is also anti-obesity. And another anti-epileptic drug which causes weight loss is zonisamide. Now the question which comes is, which anti-epileptic drug causes weight loss? This question is a separate question. Topiramate and zonisamide are two anti-epileptic drugs which causes weight loss. Fourth, orlistat and cetylistat. They are oral lipase inhibitor. So if you will eat fat, they will not be broken down by lipase enzymes. So they will not get absorbed. You will not become fat. Done. These are the list of anti-obesity drug you must remember. Let's move ahead. NAPQI is a metabolite of. This is NEET 2020 question. Tell me, bachcha log. Let's focus here. Shabash. The answer is paracetamol. ठीक है? Paracetamol. It's a one-liner. Sir, what is the active form of cyclophosphamide? This is NEET 2021 question. That is 4-hydroxy cyclophosphamide. So what is the active form of cyclophosphamide? That is 4-hydroxy cyclophosphamide. ठीक है? And this 4-hydroxy cyclophosphamide further gets converted into acrolein and some mustard. We will not write the form. This acrolein damages urinary bladder. It damages urinary bladder, which is known as hemorrhagic cystitis. So what is the side effect of cyclophosphamide? Hemorrhagic cystitis. कहानी समझ गए? And I will tell you the antidote shortly. Mesna will be the antidote. Next question. So this is everything about paracetamol you should know. Have a screenshot. I have specially made for you. Everything about paracetamol is written here. Have a screenshot, and when you will get the time, read it. Okay? Everything about paracetamol. And every point is an MCQ, which has been asked within 5 years. Which drug for gout degrades uric acid into allantoin? Let's see who can answer this. 3.5 seconds starts now. So the answer for this question is rusburicase. Let's see. Remember what happens in gout, there is increase in uric acid. Sir, how uric acid is produced? Sir, uric acid is produced from xanthine. There is a molecule known as xanthine. Xanthine goes to the liver and it gets converted into uric acid. So this uric acid comes into the blood, and this uric acid, it goes to the kidney. And when it is going back in urine, this uric acid gets reabsorbed with the help of a transporter OATP. So this is the physiology. Okay? So let's write the first drug for gout. Here you require an enzyme XO. XO means xanthine oxidase. So the first class of drug is xanthine oxidase inhibitor. Remember, xanthine is a purine. So let's write the drug which will have purine word in it. Purinol, allopurinol, oxypurinol. Because they are also purine, they are competitive inhibitor. Okay. Now, can you tell me how we can remember this name? Febuxostat. How we can remember febuxostat? Who will tell me? XO. We all have an XO, but we never get that XO. XO means xanthine oxidase. Stat means inhibitor. Now there is a drug which inside the blood will degrade uric acid into allantoin. Can we say to degrade uric acid into allantoin in the blood, you need some enzymes? So let's call those enzymes as uric acid oxidase enzyme. So there are enzymes which will degrade uric acid into allantoin. All enzymes, they end with the word ase. Rusburicase, uric acid word is coming in it. Pegloticase. So these are enzymes which will degrade. Rusburicase, it is obtained from birds. Pegloticase, it is obtained from desert mammals. Agreed? Lastly, let's inhibit OATP. So if you will inhibit OATP, what will happen? Uric acid will not get reabsorbed back into the blood. Uric acid will be increased into urine. Excretion will be more into the urine. Let's call these drugs as uricose, uric agent. Can you tell me now what does it mean? They will promote the excretion of uric acid into the urine. So the drugs are probenecid, OATP inhibitor. So it inhibits OATP. Lesinurad. Try to remember if you can the last two. Benzbromarone and sulfenpyrazone. So this is the complete list. Okay. ठीक है? Can you tell me first MCQ, most effective drug for gout? Remember, allopurinol is the drug of choice for all types of chronic gout. But the most effective drugs are rusburicase and pegloticase. They are given in allopurinol resistant cases. If there is allopurinol resistance, we give rusburicase and pegloticase. Done? Everything in one slide. Shabash. So this is a slide which I have made for you. Have a photo so that you can remember later on. Okay? Have a photo. So everything now you can understand here. Next question. This question has not been asked till now, but there is very high chances because a new anti-diabetic drug have been approved this year in June. So this drug is a dual GLP-1, that is glucagon-like peptide, and GIP-1 analog. GIP-1 is glucose dependent insulotrophic hormone. You don't have to remember the full form. Nobody is going to ask you the full form. Peptide. But try to remember. This is a very potential question, I can tell you. So the answer for this question is tirzepatide. Tirzepatide. Okay? This is a potential question for INI-CET or NEET. Very high chances it will be asked. A new question. Semaglutide and liraglutide, remember anti-obesity, GLP-1. Tirzepatide, GLP-1 and GIP. They both are given in diabetes mellitus, diabetes mellitus. What is teduglutide? Tedu means GLP-2 analog. GLP-2 analog. It is given for the treatment of short bowel syndrome. It is not given for diabetes. It is rather given for short bowel syndrome. Okay? Short bowel syndrome. Beta, I will teach you everything. FMGE, because FMGE के बाद क्या करना है? AMC तो जाना है ना? मौलाना आजादी तो जाना है ना? FMGE is also important because questions which have been asked in NEET or INI-CET, 50% same question comes in FMGE. Okay? अभी से पढ़ लो. एक ही बार पढ़ लो ना. So, one-liners in diabetes. Last year MCQ. Which anti-diabetic drug causes fractures? Last year MCQ. There are two anti-diabetes drug which causes fracture. SGLT2 inhibitor. These drugs, they end with the word with flozin. In drug के end में क्या word आता है? Flozin. I will write one drug, canagliflozin. तो इनके end में क्या word आता है? Flozin. And pioglitazone. This is a separate class of drug. ठीक है? Now, which drug should be avoided in heart failure? Pioglitazone. Agreed? Which drug is given in the treatment of heart failure? Opposite. SGLT2 inhibitor. Easy to remember now. Like canagliflozin, dapagliflozin, empagliflozin. Agreed? Done? So, जज्बात बदल गए ना? Emotions बदल गए, ऊपर नीचे हो गए. Which drug causes hypoglycemia? Only three drug. Insulin, sulfonylurea. Remember, sulfonylurea, either they will end with the word amide or they will start with the word gly. Amide, like if I say chlorpropamide, tolbutamide. Any drug which start with the word gly, glimepiride, glibenclamide, glipizide, gliclazide, sulfonylurea. Lastly, meglitinide. Meglitinides like natiglinide. They are small brother of sulfonylurea only. ठीक है? Which anti-diabetic drug causes weight loss? We already know. GLP-1 analog. GLP-1 analog, they will end with the word tide. Agreed? Tide. Another drug, pramlintide, which is AML word is coming, it is amylin analog. इसमें AML word आ रहा है, ये amylin analog है. Metformin, very important. And SGLT2 inhibitor. Weight gain, rest. No dose modification in renal failure. Which anti-diabetic drug is safe in renal failure? Why it is an important question? Because the most common cause of renal failure in today's world is diabetes. That is why we need to remember which anti-diabetic drug will be safe in renal failure. No dose reduction is required. Very important. लीनाग्लिप्टिन, डोंट फॉरगेट दिस बच्चा लोग, बिल्कुल नहीं भूलना। लीनाग्लिप्टिन गलती से नहीं भूलना। लीनाग्लिप्टिन विल मेक यू लीन, ठीक है, लीनाग्लिप्टिन, लीनाग्लिप्टिन बिल्कुल नहीं भूलना। देन पायोग्लिटाजोन, देन प्रेमलिनटाइड। This is the list. Concepts are taken in regular classes only, which is impossible here to discuss. And last drug is GLP-1 analog. Why is it so? That is conceptual part we can discuss in class. Anti-obesity drug, we know liraglutide and semaglutide. Can you tell me which drug is IV and which drug is oral? Which drug is IV, which drug is oral? Semaglutide is oral. Liraglutide is injectable. This is a separate question which was asked last year. ठीक है? Liraglutide is injectable, semaglutide is oral. Separate question which is injectable, which is the only oral GLP-1 analog, semaglutide. Last year MCQ. Okay, very good. It could be intramuscular, subcutaneous, by any route. You can combine with insulin. Now, sir, a very simple question. This question is testing your clinical skill. It is testing your common sense. That what do you think as a doctor a disease is? When to start ATT? ATT is given for TB, anti-tubercular therapy, and ART. ART is antiretroviral therapy, which is given for HIV. So a patient, we know that in India, the most common opportunistic infection in HIV is tuberculosis in India. In America, it is pneumocystis. So if a patient of HIV with TB comes to you, what you will do? Would you give both drugs for HIV and ATT together? Or you will treat any one infection first? Now remember one funda that will clear all your doubts. In HIV, first treat opportunistic infection, because opportunistic infection is the cause of death. After you have treated opportunistic infection or you have reduced the load of opportunistic infection, then start antiviral HIV drugs. So the answer is first start ATT and then start. So I will just write one line which will first treat opportunistic infection, then treat HIV. It applies to every opportunistic infection. Yes, done. Next question. Chalo, this question was asked in NEET and it has been asked in FMGE also. A female is taking ART. She complains of migraine. Since 4 days, she took ergotamine. Now she complains of tingling and pain in toe upwards to mid-thigh. And if you can see, this is how the fingers have become. There is no pulse in fingers, popliteal artery, etc. What is the cause? Remember one point. If you take ergot, your fingers will rot. If you take ergot, your fingers will rot. So what is the answer? This is ergotism. Remember, ergotism causes vasoconstriction of small end artery. It is because of vasoconstriction of end artery. So if there is vasoconstriction of end artery, you can see this is dry gangrene of fingers. There is no pulse. Yes. So if you take ergot, your finger will rot. Nikhil is asking purple toe. Remember, there is a syndrome known as purple toe syndrome. Purple toe syndrome, warfarin because of cholesterol embolization. Purple man syndrome, skin pe, amiodarone. Agreed? There is one more syndrome I want to tell you. That is purple limb syndrome, phenytoin. वो हम बाद में करेंगे। चलो नेक्स्ट क्वेश्चन फटाफट। पेशेंट विद ग्लोकोमा, there is increased IOP. I think this must have been discussed in ophtha also. Glaucoma means increase in intraocular pressure. The pressure in the eye increases because there is more aqueous humor. With acute uveitis, बच्चा लोग uveitis, uveitis means inflammation in eye. Uveitis means inflammation in eye. Which drug should not be given? अरे वाह, Avinash ji is on fire today. Piyush is also on fire. Yes. Now remember, prostaglandins, they cause inflammation. And how we can remember? There is a class of drug known as NSAID. I hope everyone remembers the full form of NSAID. NSAIDs, they reduce prostaglandin production. That is why NSAIDs are known as non-steroidal anti-inflammatory drug. So remember, which drug can cause inflammation in eye? Prostaglandin से inflammation होती है. This is the nature of prostaglandin to produce inflammation. This is the nature of prostaglandin to produce inflammation. Okay? Okay? Tired? क्या और करें? Tired? Or we shall continue? बताओ. Put your hands up. Yes, macular edema because of retinal inflammation. Ciliary edema. Iris edema, iris inflammation, heterochromia iridis. अरे कंटिन्यू, शाबाश, आज सब डिनर करके आए हैं अच्छे से. चलो बताओ फिर. ड्रग कॉजिंग फ्लैजिलेट पिगमेंटेशन. Drug causing flagellate pigmentation. So I'm just telling you the answer very fast. Bleomycin. Let's write the side effect of all anti-cancer drug at one place. ठीक है, सारे एंटी कैंसर का एक जगह साइड इफेक्ट पड़ते हैं. लेट्स मेक अ कीमोमैन. एक कीमोमैन बनाते हैं, बेचारे एक आदमी. इट्स वेरी हर्टफुल if somebody receives chemo because it is very painful to receive a chemo. So first point, let's see the specific side effect from head to toe. हेड से शुरू करते हैं, ऐसे ही आदमी बनाएंगे. हेड में SIADH, increase in ADH secretion. That is vincristine and taxane. ठीक है. In ear we have C, ototoxicity. C for cyclophosphamide and cisplatin, 2 ears. ठीक है. Don't worry, I will zoom out. Cerebellar toxicity, cytarabine. Now can you tell me, if there is cerebellar toxicity, what will happen? They will ask you indirect question. Ataxia, nystagmus, diplopia, etc. Most emetogenic anti-cancer drug. Which anti-cancer drug causes maximum vomiting? Sir, cisplatin. Which anti-cancer drug causes hepatic vein fibrosis, also known as Budd-Chiari syndrome? Busulfan, Budd-Chiari syndrome. Antidote, inhibit fibrosis. Inhibit fibrosis means defibrosis. Defibrosis means defibrotide is the antidote. D matlab inhibit, fibro means fibrosis. Easy to understand. Pulmonary fibrosis, एक और fibrosis. So it's our moral responsibility to write busulfan again. The second drug is bleomycin. Bleomycin and busulfan causes pulmonary fibrosis. Bleomycin damages type 1 alveolar cells, which we will discuss. Sir, cardiotoxicity. Cardiotoxicity, doxorubicin. Remember why it is known as rubicin? Because they are red color drug, ruby like drug. Red color, matlab Valentine Day, matlab heart. Any drug that ends with the word rubicin will cause cardiotoxicity. Doxorubicin, donorubicin, ruby matlab red, red matlab heart. What is the antidote? How to prevent it? Dexrazoxane. Antidote for cardiotoxicity, dexrazoxane. Kidney damage, nephrotoxicity, cisplatin. Antidote, amifostine. Bladder damage, below kidney we have bladder. Hemorrhagic cystitis, the patient will have painful hematuria. Cyclophosphamide, ifosfamide. Remember acrolein I have told you? Antidote for both of them is Mesna. Mesna can be given orally as well as IV. Gloves chalk neuropathy, paclitaxel. Foot drop neuropathy, vincristine. ठीक है जी, शाबाश. नाउ साइड इफेक्ट अभी खत्म नहीं हुए, और भी है. Which anti-cancer drug should not be given in Crigler-Najjar syndrome? Which anti-cancer drug should be avoided in Crigler-Najjar syndrome? Irinotecan. Irinotecan should not be given in Crigler-Najjar syndrome. Which anti-cancer drug damages palms and soles? Because sweating occurs here. These drugs, they come out in sweating and deposit in palms and soles. Damage palms and soles. Hand-foot syndrome. 5-FU, 5-fluorouracil. Its prodrug capecitabine and doxorubicin. Which drug causes pulmonary fibrosis by damaging type 1 alveolar cells, very thin cell, bleomycin. Damages type 1 cells, pulmonary fibrosis. But which anti-arrhythmic drug also causes pulmonary fibrosis by rather damaging type 2 cell? ये 2 को damage कर देगा. Amiodarone. So B is the second alphabet, damages type 1 cell. Amiodarone is the first alphabet, but it damages type 2 cells. So bleo2, type 1 cell. Amiodarone, first alphabet, कौन सा cell? Type 2 cell. याद हो गया? Good. Bleomycin, flagellate pigmentation. You can see flagella, feather-like pigmentation. This is skin. This is fish-like skin. Again, bleomycin. Again, bleomycin. Fish-like skin, feather-like skin. Bleomycin. Mitomycin, HUS-TTP, that is hemolytic uremic syndrome, thrombotic thrombocytopenic purpura, formation of antibodies. Done. सर आप आशीष सर के ब्रदर हो, आए देखेंगे अभी. Now remember, last year in INI-CET, I want to tell you one secret today. Last year INI-CET 2021, 3 questions come from this slide. I will show you one slide, 3 questions came. In INI-CET 2020, 2 questions come. In INI-CET 2020 again 2 questions came from immune checkpoint inhibitor. So for INI-CET, you can write V to the power n, very important, n raised to infinity. N raised to infinity. A little bit of physics. Understood? So immune checkpoint inhibitor. Very good. What is your answer? The answer for this question is cetuximab. Cetuximab inhibit EGFR, epidermal growth factor receptor, given for colorectal cancers, head and neck cancer and squamous cell carcinoma of. ठीक है? Now I will show you one slide. This slide, don't forget. Just read this slide before your exam. Exam से पहले एक बार जरूर पढ़ना है. ठीक है? This is a very important slide. I want that all of you should mark the correct answer. So immune checkpoint inhibitor, there are 2 types of receptor. There is one receptor known as CTLA4. If you block CTLA4, immunity increases. This immunity will kill your cancer cells. Okay? Similarly, if you block PDL1, that is programmed death receptor block, your immunity will increase. And this immunity will kill the cancers. So these are immune checkpoint inhibitor. So I will not explain you anything in this slide, but remember, I will tell you certain question. Question came where nivolumab is used, where pembrolizumab is used, ipilimumab blocks which receptor, durvalumab is given in endometrial cancer. All these questions have been asked. Which drug is given in melanoma? This has been asked. So this is very important. So you can have a screenshot. Okay? So these are the 2 questions. Now can you tell me this question? This question came in INI-CET May 2022. Now, you saw that slide. Can you tell me what is the answer? Let's see who can answer. Let's see who can answer. Let's see how is your short-term memory. Whether do you have a short-term memory, a good short-term memory, or do you have a short-term memory loss like in Alzheimer? Yes, the answer is pembrolizumab. नेक्स्ट क्वेश्चन. सारी नहीं पढ़नी बेटा मोनोक्लोनल एंटीबॉडी. जो इंपॉर्टेंट है वही पढ़ना है, सब याद नहीं कर सकते आप. इम्पॉसिबल. यू आर नॉट मशीन, यू आर ह्यूमन. द आंसर इज हॉचकिन्स लिम्फोमा. हॉचकिन्स लिम्फोमा. ठीक है बेटा, हॉचकिन्स लिम्फोमा. गुड. शाबाश गनावेल. अन्यू. Which drug is not given in severe COVID-19 infection? Let's say children तो हमने ऐसे ही डाल दिया. The answer is ivermectin. Tocilizumab given. It blocks interleukin 6. It is also given in rheumatoid arthritis. Remdesivir, it is given. It inhibits RNA polymerase. Steroids and heparin, they are the only drugs in COVID which can reduce mortality. Remember, no antiviral drug in COVID has reduced mortality. The only drug which can save the life of a person is steroid and heparin. Steroid, why? Because it inhibits inflammatory ARDS. Why heparin? Because it inhibits DIC, disseminated intravascular coagulation. The only life-saving drug in COVID is steroid and heparin. No other drug is life-saving. Not even tocilizumab, not even remdesivir. But they have been approved. Okay? With steroid, many steroids are there. Dexamethasone, methylprednisolone. Okay? So, one last question. एक और कर लें question? एक और question कर लें? Last question. Important topic है इसलिए. So the answer is clindamycin. Clindamycin causes pseudomembranous colitis. These three drugs are given in the treatment of pseudomembranous colitis. ठीक है? ठीक है? So remember, this is the drug of choice. Fidaxomicin is most effective drug. Unfortunately, it is not available in India. In America, it is the drug of choice, but in India, still the drug of choice is oral vancomycin. Okay, fidaxomicin is very important for you. It has been asked. Fidaxomicin पूछा जा चुका है. It has been asked in your recent NEET exam. Okay, even the options are MCQ. Remember, I have made the questions like that so that the options are even MCQ. हाँ बेटा, टेलीग्राम पे भी है, फेसबुक पे भी है. देर आए पर दुरुस्त आए. आपको एंजाइटी हो रही थी. आई थिंक आज के लिए इतना बहुत है, नहीं तो आप थक जाओगे. So I was seeing there was a lot of anxiety before the session, but trust me, I will tell you one thing. If you don't learn by concepts, you will never able to remember. I have felt this and you also must have felt it. So there is a very famous quote I want to share with you. Actually, I am teaching from past 10 years. So I just wanted to tell you that a very famous person has said that I know that I am intelligent. It applies to you or everyone else because I know that I know nothing. I know that I know nothing. That is why I'm intelligent. Can you tell me who has said it? It has been said by the greatest teacher, which we call it as. तो बेटा आपको क्या आता है, that is very good. But in a very small session, I will just share one quote of wisdom with you. You should first know your drawbacks. पहले आपको अपने drawbacks पता होने चाहिए. पहले आपको अपने ड्रॉबैक्स पता होने चाहिए. अगर वो पता है तभी आप ओवरकम कर सकते हो. इफ यू नो योर ड्रॉबैक्स देन ओनली यू कैन ओवरकम. ओके, सो लर्न एवरीथिंग विद प्लेजर, live your life with prosperity, I will say. So this is all from my side, and it was a pleasure for me teaching you all, and it was such an energetic chatting room. I also felt highly energetic interacting with you all. So I wish you all the best. This is the time that you should not take rest. ये अब रेस्ट करने का टाइम नहीं है, ये टाइम है प्रूव करने का. ये भूल जाओ, फॉरगेट वट एवर योर आपकी पुरानी प्रिपरेशन कैसी है, इट डजेंट मैटर. You have acknowledged that you don't know anything. You know nothing. You acknowledge it right now. That I don't know this part, I don't know this part. First acknowledge it. Acknowledge it. Acknowledge it and overcome it. A small suggestion for you. Okay? Yes, I'll be taking many more session, and I am guaranteeing you all. आपने कभी ऐसी फार्मा नहीं पढ़ी होगी, मेरे से अच्छी भी पढ़ी होगी, बुरी भी पढ़ी होगी, बट जैसा मैं पढ़ाऊंगा ऐसी नहीं पढ़ी होगी. ओके, एवरी टीचर इज गुड, एवरी टीचर, ऑल टीचर्स आर फाइन. राइट नाउ एट योर स्टेज आपका काम नहीं है ये टीचर वो टीचर ना. जो अच्छा पढ़ाए पढ़ो. बी सिंपल इन योर लाइफ. Don't go into unnecessarily controversy. Be honest with yourself. बेकार में एनर्जी इधर उधर ड्रेन नहीं करनी. एग्रीड? कभी नहीं एनर्जी ड्रेन करनी. एनर्जी फोकस रखनी है. That right now the purpose of my life, right now the purpose of my life is to crack entrance exam with best of my capability. Agreed? आगे का बाद में देखेंगे. I hope someday you will also sit here and teach. But right now your purpose is to crack this exam. Don't waste your energy here and there. It will not gain you anything. Trust me. है ना? कहते हो सही कह रहा हूं? And I can assure you one thing. Regarding pharma tension नहीं लेनी. Regarding pharma, I am here with all of you. जब तक समझ नहीं आएगा मैं समझा के छोड़ूंगा. Today was just a very small session. It was just an introduction. पिक्चर अभी बाकी है, पिक्चर बाद में है. अभी तो ट्रेलर था. ठीक है, अभी ट्रेलर था, पिक्चर अभी पूरी बाकी है. चलो, it was sheer pleasure. I wish you all the best. I think we should say goodbye right now. And now remember one thing, change is always good. So change is always good. Change is the true nature of everything. अगर चेंज नहीं हो रहा तो वो अच्छा नहीं है. चेंज होना चाहिए. आई विश कल आप यहाँ बैठे हो और बढ़ा रहे हो, बिकॉज प्रोबेबली यू विल बी बेटर देन मी. ओके, चलो, गुड बाय.